But I'm also strongly in favor of repeal of IPAB, the Independent Payment Advisory Board created under Obamacare. We know, and our colleagues on the other side of the aisle, many of them know, that this was the most egregious part of this 2,700-page piece of legislation, which is now the law of the land. But what it is, Mr. Chairman, IPAB is their way of saving Medicare. I'll ask them time after time, what is your plan to save Medicare? They have no answers. All they want to do is continue to criticize our side of the aisle when we have meaningful, thoughtful plans to save and protect and strengthen, not just for these current recipients under the Medicare program, those who are seniors, those who are disabled, but also our children and our grandchildren. What do we get from this side of the aisle? From the Democratic side, we get IPAB. The language says no rationing, yet the provisions call for cutting reimbursements to providers, and eventually, without question, just as it has in Canada and the UK, Mr. Chairman, that leads to denial of care. And if that's not rationing, I don't know what it is. Let me, in the remaining part of my time, speak a little bit in regard to H.R. 5, the Health Act, the Medical Liability Reform Act. The gentleman from Iowa, the trial attorney, was just up here trying to imply that we would take away a person's right to a redress of their grievances if they had been injured by a medical provider or a health care facility because of practice below the standard of care.
I yield the gentleman another 1 minute.
Gentleman's recognized for one additional minute.
And I thank the gentleman. The gentleman from Iowa knows, in fact, that that is absolutely not true. What we do in this Health Act is limit the awards for so-called pain and suffering at $250,000. And, Mr. Chairman, indeed, a number of states, after California enacted this law 35 years ago, Texas, Florida, my own state of Georgia, have enacted caps higher than that. And no doubt other states will do so in the future, because this bill specifically says, and it's called the flex caps, that if a state wants to enact a limit on non-economic of $1 million and have it applicable to multiple defendants, they can do that. They have the right to do that. And in regard to the injury to a patient, there are no caps whatsoever. There are still suits that are awarded to injured patients that are in the millions of dollars. So the gentleman from Iowa was totally disingenuous in what he was trying to explain. Very smooth talking, very convincing lawyer. That's what we expect. But we want to end frivolous lawsuits that those who are truly injured get their day in court. Expired. And that's what this bill does. And I yield back the balance of my time.
The gentleman has expired. The gentleman from California.
Chairman, I yield myself 1 minute. I
Gentleman's recognized for 1 minute.
Gentleman who is a physician for his comments. He said he wants to save Medicare. He said the Republicans want to save Medicare. They want to save